Good day, everyone. Today, let's talk about bronchitis, something many of us have faced, especially in winter. Imagine your lungs as an upside-down tree. The trunk is your windpipe, and the branches are your bronchial tubes. When these tubes get inflamed, that's bronchitis. It makes breathing harder and triggers a lot of mucus. This extra mucus clogs your airways, leading to that classic persistent cough. There are two main types, acute and chronic bronchitis. Acute bronchitis usually follows a cold or flu, hits hard for a week or two, then clears up on its own. Chronic bronchitis is more serious, a productive cough lasting at least 3 months a year, for 2 years straight. Chronic bronchitis is often part of COPD and is usually caused by long-term irritant exposure, especially smoking. Acute bronchitis is like a passing storm. Chronic is a marathon. Both types involve inflamed airways, but chronic bronchitis sticks around and needs ongoing care. The key difference: acute is short-term and often viral. Chronic is long-term and linked to lifestyle or environment. If you're coughing for weeks or years, it's time to pay attention. Understanding the type you have is crucial for proper treatment. So bronchitis isn't just a cough, it's your lungs asking for help. Let's dig deeper into how you get it and what you can do. Can you catch bronchitis? Not exactly, but you can catch the viruses or bacteria that cause it. Most acute bronchitis cases are triggered by viruses like the common cold or flu. When someone coughs or sneezes, those germs spread through droplets. If you breathe them in or touch contaminated surfaces, you might get infected. Not everyone exposed will get bronchitis. It depends on your immune system and other factors. So while you can't catch bronchitis directly, you can catch the germs that lead to it. That's why good hygiene and keeping your distance when sick matters. Viruses are the main cause of acute bronchitis. Think rhinovirus, influenza, and RSV. These viruses infect your airways, triggering inflammation and mucus. Sometimes bacteria can take advantage after a viral infection, but that's less common. Chronic bronchitis is almost always due to long-term exposure to irritants, especially cigarette smoke. Smoking damages the tiny cilia in your airways, making it harder to clear mucus and easier for infections to take hold. Other irritants include air pollution, dust, chemical fumes, and secondhand smoke. Protecting your lungs by quitting smoking and avoiding pollutants can prevent chronic bronchitis. If you work in dusty or fume-filled environments, wear a mask. Your lungs will thank you. The hallmark of bronchitis is a deep, persistent cough, often starting dry, then turning productive with mucus. Mucus may be clear, yellow, or green. Color alone doesn't mean it's bacterial. Other symptoms: fatigue, mild fever, chills, sore throat, and chest discomfort. You might feel tightness or burning in your chest, and sometimes hear wheezing. Shortness of breath can happen, especially with activity. Most cases clear up on their own, but see a doctor if you have a high fever, cough up blood, severe shortness of breath, chest pain, or symptoms lasting over 3 weeks. These could signal something more serious, like pneumonia. Listen to your body and don't hesitate to seek help. Preventing bronchitis starts with avoiding the viruses that cause it. Wash your hands often and avoid touching your face. Keep your immune system strong with a healthy diet, exercise, and enough sleep. Get your annual flu shot to lower your risk. If you do get bronchitis, antibiotics won't help unless it's bacterial. Focus on rest, fluids, and soothing your airways with steam or a humidifier. Over-the-counter pain relievers can ease fever and aches. Let yourself cough to clear mucus, but if it's keeping you up, talk to your doctor about relief. Most people recover in a week or two, though the cough can linger. Be patient. Your body needs time to heal.